Hi, I'm Dr. Tarazi. I would like to thank you for watching this video made by your obstetrical providers from Norwood Hospital. At your first prenatal visit, we gave you a folder that had breastfeeding information. Please take a moment to review it. As a maternity team, we have found that many of our patients have the same questions about breastfeeding. We hope that understanding the benefits of breastfeeding will help you make an informed decision about how to feed your baby. You will also get an idea of what to expect during your hospital stay and the support we will provide.
Breast milk is the perfect food for your baby. It is easier for them to digest, so they often have fewer gastrointestinal issues. Breastfeeding protects babies against certain illnesses. Specifically, it decreases the rates of ear infections, respiratory infections, and gastrointestinal infections. Breastfeeding also reduces the rate of long-term chronic illnesses such as asthma, diabetes, obesity, and allergies. In addition, breastfeeding reduces the rate of sudden infant death syndrome, or SIDS, as well as many different types of childhood cancers. I do want you to know that breastfeeding has benefits for mom too. It helps to reduce the rates of breast and ovarian cancer. It also helps to reduce the rate of adult onset diabetes. Furthermore, it can help mom to return to pre-pregnancy weight and shape much faster. Research has shown that one of the best things you can do for your newborn is to hold them skin to skin. This means that your baby is naked, wearing only a diaper and held to your naked chest. There should be no clothing or blankets between you and your newborn. Babies held skin to skin as soon as possible after birth have more stable breathing, heart rate, and blood sugar. Early skin to skin help gets breastfeeding off to a good start. Most moms and dads have said that it's a great way to bond with their baby.
Your baby will stay with you in your room throughout your hospital stay. This is called rooming in. Babies want to naturally be close to their mothers. Probably the greatest benefit of rooming in is that it allows the mother to recognize her infant's feeding cues and feed at the earliest signs of hunger. Rooming in helps you learn how to take care of your baby with the nurse's presence and support. It helps build your confidence in caring for your baby, including learning to nighttime parent. I'm going to talk a little bit about your baby's feeding cues. Babies will start letting their parents know that they're hungry even when their eyes are closed. You might notice them sticking their tongue out and smacking their lips. At times, their eyes may be open, and you might see them trying to put their fists into their mouth. Recognizing your baby's early feeding cues makes it easier to latch your baby and have a more successful feeding. Feeding your baby on cue helps create a good milk supply.
This graphic shows some of the most commonly used breastfeeding positions. Notice that the baby's hip, ear, and shoulder are all in alignment in each of these positions. During your stay here, our OB staff, nurses, and lactation consultants will educate you on the proper position and attachment or latch. Your nurse will assess you during feedings to make sure that the baby is latched correctly, positioned well, and showing signs of swallowing. Position and latch are very important elements for breastfeeding success. Many new moms are surprised at how challenging this can be. If the baby's latch is not correct, she won't get the proper nutrition, and this could reduce mom's milk supply as well as cause sore nipples. Patience and practice are key elements for success. The baby needs to have his mouth open very wide, taking in as much of mom's breast as possible. This helps stimulate adequate milk production and decreases mom's discomfort.
We encourage you to try breastfeeding as soon as possible after birth, usually within the first hour of life. Research shows that babies are more likely to become successful nursers when they feed at least 8 times in 24 hours. The first milk, called colostrum, is packed full of nutrients and antibodies, specifically designed for your newborn. Colostrum digests rapidly, so you may need to feed the baby often, especially in the first few days. These frequent feedings are called cluster feedings. They are common to see beginning on the second night of life. There are no time limits set on the frequency or length of feedings. The more often your baby nurses, the more milk your body will produce.
You might think that it's a great idea to give your baby a bottle in those challenging early days after giving birth. Giving a baby a bottle with a nipple on it has been well established to cause confusion in the newborn who's trying to learn to breastfeed. The muscles that a baby uses to breastfeed are very different than the muscles a baby uses for a bottle nipple. Also, formula flows out of a bottle more quickly than milk from mum's breast, and these two things together, the different muscles and the different rate of flow, can cause something called nipple confusion. And this can make your baby less content with breastfeeding and decrease your milk supply. The American Academy of Pediatrics recommends avoiding the use of pacifiers or bottle nipples in the first month after birth until breastfeeding is well established.
Thank you for watching the video. If you would like to watch it again, please visit our website for a link. We strongly encourage you to attend the Breastfeeding 101 class at Norwood Hospital. This 2-hour class will help you better understand breastfeeding your baby. Our childbirth classes will teach you comfort measures that provide natural pain relief. They can be very effective during labor and childbirth and make breastfeeding easier. If this video raised any questions, please discuss it with your provider at your next visit. If you cannot or do not want to breastfeed, then one of our nurses will discuss formula preparation with you. We look forward to caring for you and your baby, and we will see you at your next visit.